Welcome back. My name is Dr. Carl Baird, and today I'll be taking you through a 15-minute exercise routine for degenerative disc disease in your lower back. So just a few things to mention before I get started. This is actually our level 2 exercise routine, which means if you haven't, I'd strongly recommend you go to our level 1 routine. Just make sure you can do all those exercises comfortably before moving to this, because it's going to be a little bit more challenging. And again, when you're dealing with something like degenerative disc disease, safety in your exercise routine is more important than how long you can hold certain positions and how heavy you can go. So make sure you do level 1 first. Next, for this exercise routine, you are going to need a band. So again, as you start getting into more strengthening exercises, you have to add a little bit of resistance. I recommend everybody has one of these bands. I'll put a link in the bio below to my Amazon store. They're like $5 on Amazon. But if you don't have it for today's workout, I'll give you some variations. And lastly, just a few things to think about when we're going through this exercise routine. There's a couple things that we want in regards to treating degenerative disc disease. The first one is we want gentle movements to ease pain and stiffness. So one of the hallmarks of this DDD is just stiffness, especially early in the morning. So what we want to do is give you some exercises to help just decrease that stiffness and help with the pain a little bit. And secondly, and more importantly, we want movement and strength routines that are going to lower impact on your discs as you move throughout the day, because that's going to be what prevents this degenerative disc disease from getting worse. And so what we'll include in today's routine are safe and effective strengthening exercises to limit impact on your spinal discs. So that's all I got for you. Let's go ahead and get started. I'm going to meet you on your hands, our hands and knees. And we're going to start with, again, just those gentle movements. So that cat-cow, all we're going to do is let the head hang, curl your pelvis in while you arch your back. And then the cow position is you do the opposite, where you rock your pelvis back, lift your head up, and drop your stomach like you're a cow with udders, I think is how they got that name. Good. All right, so we're just going to move back and forth through this. Again, start slow, but as you start to warm up a little bit, you can go a little bit faster. And again, you can start maybe shifting side to side, just wherever you're feeling nice and stiff. The goal is just to get some gentle, pain-free movement to help with that stiffness. Good. Next, we're going to move on to our stomach. We're going to do an exercise called the prone press up. So what that looks like, easiest variation is just coming on your elbow here. And we want to spend about 10 seconds in this extended position. It helps decompress the spine a little bit. Obviously, if this causes pain, just keep going with your cat-cows. After 10 seconds, you can take a little break. And if that felt good, the next progression up is to come up onto your hands. And again, the goal here, really relax your hips down. But this extension position, again, helps decompress the spine a little bit. Good. And then you're just going to relax. And we'll do that one more time. So again, elbows, if that's most comfortable, or hands, if you're feeling up to it. Trying to relax those hips. Dropping your hip as much as you can all the way to the floor. Good. And then from there, we're going to shift our hips back into our heels. And this is just a little child's pose position. Reaching out in front of us. This is another good just decompression position for that spine. And you're just going to hold. If you want, you can move to the left. That's going to stretch out the right outside of your right shoulder. You can move to the opposite direction. Back to the middle. And again, you can just sit in this position. It should feel pretty good. All right. Then we're going to move onto our back. And we're going to start with windshield wipers. So again, we're on our back. We got our feet a little bit wider than hip width apart. And then from there, you're just going to drop both your knees to one side. And again, it's okay if your lower back comes off the ground a little bit here. This is another just slow, gentle movement, trying to get some rotation in that spine. So again, just go slow. And again, the goal here, just ease pain and stiffness. We don't need to overdo it. Good. Should feel pretty good. Feels good for me. Just a few things to keep in mind as we go through this with the degenerative disc disease is that there's different levels, right? So a lot of times we hear this diagnosis from a doctor and it's definitely like a freaky sounding diagnosis. Oh, degenerative disc disease. And they often use it as a way to justify moving to more intensive measures like injections or surgery. But it really just depends on your level. I mean, if you x-rayed my spine, there's a little bit of disc degeneration just because I was an athlete growing up and there was a lot of impact on my spine. But it doesn't mean that there's something wrong with me, right? So just keep that in mind as we go through this. Make sure you get a second opinion before going into something like a surgery. Okay, next, we're moving into our strengthening exercises. So this is where the band is going to come in handy. If you don't have it, don't worry, but we're going to do our glute bridge, but use the band to add a little bit of resistance. So what we're going to do is lay the band on the ground, and then you're going to make a figure 8. From there, I'm going to take my 2 fingers, go through the 2 circles of that 8, and make 1 circle. All I'm going to do there is put it around my feet, add it around my knees, and then we're just going to do that glute bridge that we did in level 1. So good. We're going to go up and down. Good. So all the band does is it adds a little bit of resistance. And again, you can play around with the position of your feet. If you're feeling it too much in the hamstrings, probably means your feet are a little bit too far out, which that's where I was, which is why I pulled my feet in a bit. But what we're doing is strengthening your glutes and your hamstrings. These by far are the most important muscles to treat lower back pain and knee pain, which are 2 of the most common things I see in my clinic, and a lot of times are just the result of, again, our lifestyle in general is, for most people, requires a lot of sitting, is rather sedentary, which means we don't use our glutes and we don't use our hamstrings, which is why it's so important to include exercises like this. The bridge is also very safe. You're on your back, you can control the movement, so you don't risk re-aggravating anything. All right, good. Next, we're going to move to simple core exercise. So we're going to start with a little knee plank. So I'll meet you on your knees and your elbows. And all we're going to do is just hold this position here. So this is going to be our core strengthening exercise. The reason I like it for DDD is because it's an isometric contraction, meaning there's not any movement that's going through the spine, but it really, really targets your core. And there's also a lot of different variations based on your ability level. So this is the easiest variation, but if you wanted to make it harder, the next step up is obviously just go on your toes like that. And again, the goal here is going to be to hold it for a minute straight. But if you're not quite there yet, it's okay. Take a quick break. I would stop the timer and then just get back into that plank. And each time you do it, you'll get stronger and stronger until you can hold it for a full minute. Nice work if you're still with me. We got about 3, 2, and 1. All right, the next exercises are going to be standing. So I'm going to change the camera, but I'll meet you up in the standing position. All right, and next we're going to start working on our hip hinge movement. This is a very important movement pattern for lower back pain that everybody with any sort of back issue should learn, understand, and practice in order to protect their low back as they move throughout their day and build strength in their glutes and hamstrings, which, as I mentioned previously, also very important. So we're going to do the banded hip hinge variation. Again, if you don't have a band, you can do this without a band, but I like this because it adds a little bit more resistance to those hamstrings, so you get a little bit more out of it. All we're going to do is we're going to set it on the ground, try to step right in the middle with both of your feet, and then you're just going to come to the standing position. So I got the band here at my side, and to perform the hip hinge, all we're going to do is reach those hips back, keep my knees nice and loose, stop once I feel tension in the hamstrings here. So again, I don't want to go too low because that's where I start to round my back, and that's where you're going to get issues with your degenerative disc disease. So this is why it's really important we learn this movement. So again, what it looks like, send the hips back, keeping that neutral spine, tension in the hamstring, and back up. So what we really want to focus on is 1, the movement is reaching the hips towards the back wall. It's not bending forward like that drinking bird toy. And then stopping when you feel tension in the hamstring so you can keep that nice neutral spine to protect your lower back. So again, this is a foundational movement in the strength training world, which means it's used to do a lot of other movements, which is why it's important, but it's also something you use throughout your day. So the more you can practice and perfect this, the better it's going to be. Last one here. Good. All right. Next one, we're just going to do a simple air squat. So if you're not quite comfortable with the squat yet, you can also do what's called a box squat, which just put a chair or a box behind you just to protect you a little bit more. But to perform a squat, all we're going to do, we're going to start with our stance. So again, about hip width, toes pointed out. There's more we could get into about finding the right squat stance. This is what's best for most people. But again, we just want it to be comfortable going down. And then once you have your good stance, what you're going to do is you're going to start by unlocking at the hips and then bring your hips down. Good. So we're just going to go again, slow and controlled through this. Like I mentioned, if you want a box behind you to kind of reach and tap at the bottom, that's okay too. For our purposes, I like stopping about when your thighs get parallel with the ground. Even if you can go a little bit lower, you're a little bit more flexible than me. When we're training around pain and injury, it's important that we focus on keeping things safe. And this is just a nice safe depth to go if you're not quite sure how deep you should be going. But again, this is just full body leg strengthening, also targets hamstring and glutes, which, as you've noticed, is very important. All right, we got our last one here. And we're done. So we've made it one time through. Let's go ahead and go back onto our mat and we'll start with round 2. All right, we're back for round 2. Let's go ahead and start on our hands and knees and do another round of those cat-cows. So remember, cat, we're arching the back, tucking that pelvis in, letting the head hang. And the cow, just the opposite. So it should feel a little easier, a little less stiffness around 2. The other thing to keep in mind is you just want to keep this in a nice pain-free range of motion, meaning if you're doing this and you kind of feel pain right here, you don't need to push into it to get that full range. You can just stop and then go the other way and stop when you feel that stiffness. What you'll find is that as you get or do this a little bit longer, it starts to feel a little bit better and you can improve that range of motion. All right, good. Next, we're going on to our stomachs and we're doing the prone press up. So remember, first one is elbows, if this is where you're at. If you feel comfortable, you can go ahead and go onto your hands, which I'll do next. We're going to do a 10-second hold here. Then we're going to come down to the mat, relax a bit, and then come back up. Just getting that extension in the spine, decompress those discs a little bit. Again, if this is uncomfortable, it's okay to just keep doing cat-cows. Good. Let's go back down. Goal is straighten those elbows. Really try to relax your hips down. Just get that extension in your spine. Good. We're going to go ahead and do one more. So a lot of this degenerative disc disease can be attributed to repetitive flexion movements, just kind of being hunched over for long periods of time over the course of our life. And that's why this extension movement is so good. It's kind of the opposite of that, which usually makes it feel pretty good. Okay, then we're going to shift back into our resting position, which again is just this child's pose. Trying to bring our hips all the way back to our heels. Again, you can just rest here, or you can reach to the left, get more of a stretch on the upper body, and reach to the right, stretch to the left. But again, it should feel good on your lower back. This is a good decompression exercise. All right. Let's go ahead and head on to our back, and we'll do our windshield wipers. So again, just getting that little rotation in the lower back. Should be a nice, gentle stretch to the muscles, but it also, again, gets that pain-free movement in the spine, which helps with pain and stiffness, which is what we're trying to do here. Should feel a little bit better or easier. Round 2, a little less stiffness. Nice work. Ooh, got a fly buzzing. All right, good. Okay, now we're moving into our strengthening exercises. So we're going to start with our glute bridge. Just a reminder, if you have a band, we're going to do the banded version. So lay it on the ground, make that figure 8. Take your 2 fingers in the 2 circles made by the figure 8, then even it out. You're going to hook it around your feet, hook it around your knees, and then we're just going to do our glute bridges. Good. Pressing up and pressing down. Really trying to feel it. Those glute and hamstrings. Honestly, when I put programs together for people, I think the glute bridge is included in almost everything, whether back pain, knee pain, foot and ankle pain, leg pain, anything lower body for sure. Building strong glutes and hamstrings is going to limit the impact that goes through your body for less joint pain as you get older. So if you're taking one exercise out of this routine, glute bridge. Bridge every day. And it's safe. Not a lot of force goes through the spine or your knees itself, which is why we like it. And again, it's very effective. You should be really feeling those glutes at the top, back down. All right, take the band off. We're going to move into our plank. So we're just going to do that elbow plank, starting on your knees. If this is the level you're at, if you want to challenge yourself, move on to your toes. But it's just going to be a hold for 1 minute. Again, if you need to take a break, it's okay. Just kind of shift your hips up is the best way to give yourself a little break. And then move right back into it. You're doing good. Go to your happy place. Just don't think about the time. At this point, everyone's, how far am I? I tell you, you're going to want to bail. Again, just take a break. It's okay. But it's fun. The more you do it, the longer you'll be able to hold it. You'll see that improvement. You can see how much stronger you get, even just after a week of doing planks. You have 5 seconds left. 3, 2, 1. Nice work. Okay, we'll finish up with our standing exercises. I'll go ahead and meet you there. All right, we're moving into our banded hip hinge. So again, grab the far edges of the band, set it on the ground. Try to stand right in the middle so the band's equal tension in your right and left hand. And then from there, all we're doing is, again, we're reaching the hips back, keeping a neutral spine, and stopping once you feel that tension in the hamstrings. Just a reminder, if you don't have a band, it's okay, you can do this without a band. You just don't quite get as much of that tension in the hamstrings, but you still get to practice the hip hinge, which, as we talked about the first round, one of the most important movements to protect your lower back as you move through the day, and it's a foundational strength exercise that you use in a lot of other strength training exercises, so you want to make sure you have it down so you can safely perform other exercises. But again, if you don't have one of these bands, I highly recommend you get one. There's so many things you can do with them. I'll link my Amazon store, which has the exact bands that I use. They're about $5–10. They're not a lot. All right, good. Step out of the band. We'll end with some squats. So again, find your squat stance, just changing your width and the amount of toe out to what feels most comfortable for you. And then from there, you're sending the hips back first. So again, unlocking at the hips, then dropping the hips down, stopping when your thighs are parallel, and back up. If you need, remember you can put that box right behind you there and just go at a pace that's comfortable. You don't need to go really fast, just slow and controlled. You can hold for a second at the bottom for a little extra challenge. Just finding the right level for you. That's the hardest part about these videos, is that everybody's at a different level. So I try to keep them where you can find the level that's best for you just by changing a few things. With the squat, you can go faster. You can hold at the bottom if you want to make it a little bit harder. You can add a box if you want to make it a little easier. Last one here. And done. Congrats. You made it through our physical exercise routine for degenerative disc disease. So there you have it. That is our 15-minute physical exercise routine for degenerative disc disease. As a reminder, the goal of any exercise routine designed to treat DDD is to get some gentle movement in the spine to ease pain and stiffness, but more importantly, improve movement and build strength to limit impact on your spine to make sure that that DDD doesn't get any worse. So again, my name is Dr. Carl Baird. If you have any questions, leave them in the comments below. I'm happy to help. Thank you so much for watching. We'll talk to you soon. Hey guys, it's Dr. Carl Baird here, and I wanted to thank you for watching our previous video and supporting our channel. Now, if you're somebody who's looking to build strength, to solve joint pain, keep active, and maintain your lifestyle as you get older, be sure to subscribe to our channel to watch all of our new videos. You won't find it anywhere else.